So the Lumenis UltraPulse fractional ablative CO2 is an extremely versatile device that I use primarily for laser resurfacing and the treatment of flat scars, atrophic scars, or hypertrophic scars. The device has been designed to provide very high peak power, the highest energy fractional ablative device on the market with excellent depth of penetration. The device has a remarkable ablation to coagulation ratio, which means that you can treat patients, when you're treating patients with laser resurfacing, you can ablate tissue with minimal thermal damage to surrounding tissue, which makes the treatment essentially far safer than other fractional ablative technologies. In terms of scar treatments for hypertrophic scars, we have the option of increasing the energy and increasing the depths to proportions that will treat hypertrophic scars even several millimeters in depth, up to approximately 4 millimeters, with excellent safety and fast recovery times. An important benefit of the UltraPulse CO2 is that when you treat patients with hypertrophic or tethered scars, you have the ability to increase the range of motion with fairly limited downtime and very fast recovery periods, which can really change people's lives when you're treating scars that have debilitated and immobilized either their extremities or their neck or their face. You can have profound results in short periods of time. We've had patients that have had significant recovery times as fast as 3 days. Overall, I think the UltraPulse CO2 is very versatile, can be used for a number of treatment options on the face, including irregular pigment, fine lines, irregular texture, and decreasing pore size, which for a number of patients, treating all of those in one session can lead to profound improvement in their self-esteem and in their cosmetic appearance.
I was starting to show some signs like dark spots and things that I did not like.
I wasn't comfortable with myself. I didn't feel as old as I looked.
I didn't like my looks at all. I was kind of sad, didn't like to look in the mirror because all of a sudden there was just this age look that I wasn't used to.
Because I try to take care of myself, and maybe it's good genes, and when I looked in the mirror, or really worse, looked at pictures of myself, I was just horrified. I would just look at these pictures and say, "Mother?" I couldn't believe that that was me, because I didn't feel like that.
This is a fractional ablative handpiece that allows us to deliver about 0.2 millimeter spot sizes up to a significant depth, several hundred microns, depending on your energy settings. For this patient, she has some lines on her forehead that really concern her, as well as some lines periorbitally, what's commonly known as the crow's feet, and as well as some enlarged pore size, some irregular pigmentation in these areas. So what we're going to do is treat the wrinkles with the deep FX, and then do a light resurfacing of the whole area above her cheeks to blend everything in.
It was so easy. I expected more. I don't know what my expectations were, but I didn't expect it to be as easy and quick.
After the procedure, you don't hurt at all. There's no pain involved.
I never experienced any pain the whole time.
How was that overall?
It was great.
The two good girlfriends, they noticed it within about 2 weeks. They said, "You look great."
I noticed that my skin was tighter. Some of the wrinkles, especially the lines over the eyes, like under the eyebrows, it was gone. It was just gone. It was great. I would do it again. I have already recommended this procedure to many friends and family members. Oh, I feel much better about myself. Now I don't mind looking in the mirror, because I know that each day or each week, it's just going to get better and better. It already is better, so I like to look in the mirror now.
I feel confident now. I feel a lot more confident about being out there and interacting with people. And, maybe even, as I said, doing Match.com. I wouldn't ever have thought about it before because of my age. But now I'm thinking about it.